When couples are unable to conceive, the blame is always on the woman. Meanwhile, a man can be the cause of infertility too. One of the major causes of infertility in men is low sperm count. What is low sperm count? A low sperm count simply means the semen you ejaculate during orgasm contains fewer sperm than normal. A low sperm count is called oligospermia. A total absence of sperm in a man's ejaculate is called azoospermia. A normal sperm count should be between 39 million to over 900 million sperm per ejaculate. That is, the total amount of sperm that is supposed to be in a man's ejaculate, it is not supposed to be less than 39 million sperm cells. If it is less than 39 million sperm cells, there is a problem. Also, we can take a little amount like a ml, like 1 ml of semen from a man's ejaculate. If we take at least 1 ml from a man's ejaculate, the total amount of sperm that is supposed to be in that fluid, that semen, that 1 ml semen we took from a man's ejaculate, it is not supposed to be less than 15 million sperm cells. If in that 1 ml of semen, the sperm inside is less than 15 million, there is a problem. We can say a man has a low sperm count. In today's topic, I'll be telling you guys the causes of low sperm count, treatment, how to prevent it, and home remedies. Stay with me to the end of this video so we can do this together. Hello everyone, you're welcome back to my channel. If this is your first time here, you are the right place. Kindly hit the subscribe button, click on the bell notification as well, so you always get notified anytime I post a new content. And for my returning subscribers, for my returning viewers, thank you so much guys, I love you all. Today it's about low sperm count, because there is this stigma that comes with a woman that is unable to get pregnant. There is pressure from family, from friends, from colleagues, but they are forgetting that a man can be the cause of infertility too. So it is advisable you go see a doctor for sperm analysis and also some other tests if your wife is unable to get pregnant, to be sure the problem is not coming from you. Low sperm count. Low sperm count is one of the major causes of male infertility, and I already told you guys about the normal amount of sperm that a man is supposed to have per ejaculate, which is not supposed to be less than 39 million sperm cells. Anything lesser than this, there is a problem. There are also parameters that is being checked during sperm analysis, like motility. Motility is the sperm ability to swim. There are two types: the progressive motility and non-progressive motility. The progressive motility is when the sperm is deposited in a woman's body, then it flows from the vagina through the cervical canal to the uterus, that is the womb, then to the fallopian tube. That is progressive motility. But there are also sperm that the moment it's being deposited in a woman's body, it does not swim straight to the fallopian tube. It forms a zigzag pattern, or it just swims around the same spot. Those ones are non-progressive motility. Now imagine a man deposited in you, like in his mind he has come, he ejaculates, expecting pregnancy, but the sperm he deposited in you did not even leave your vagina area or did not leave the cervical canal. How is it going to get into the fallopian tube to get the egg fertilized? It is impossible, because the sperm is not progressive. Another parameter that is checked during sperm analysis is vitality. Vitality is the number of live cells present in a man's ejaculate, the number of live sperm cells present in a man's ejaculate. Because some men releases, they ejaculate with dead cells. It's either the sperm cells dead the moment they're being released, or it contains lesser than the amount of the live cells, live sperm cells. If the total amount of live sperm cells a man releases, it is less than 58%, there is a problem. It's just releasing, but most of the sperm, they are dead. So if this sperm, the live ones, they're less than 58%, to get a woman pregnant, it will be difficult. Another parameter is volume. Yes, when a man releases, the volume, the amount of semen a man is supposed to release, it is not supposed to be less than 1.5. It should be between 1.5 to 7.6. Anything lesser than 1.5, if the volume of the total amount of the man's ejaculate is less than 1.5, there is problem as well. Those are the quantitative parameters. Now, let's take a look at the quantitative parameter. The quantitative parameter is just to check for any deformity in the sperm. Because if there is any deformity, whether it's in the head of the sperm, the mid, or the middle, or in the tail, there is going to be a problem. The tail is the one that do most of the job in swimming, right? So if this tail is shorter, too long, or too thin, or too thick, it will not be able to move freely. Also, if the head of the sperm is too big, it will not be able to penetrate the egg to get it fertilized. You see why it is very important for a man to go for sperm analysis too and hormone testing when a woman is unable to get pregnant, because there are a lot of factors that can affect a man's sperm too. Now, what are the causes of low sperm count? The first cause of low sperm count I'll be talking about today is autoimmune. Antibodies that attack sperm. This happens when your own immune system, your own antibodies, that is the fight of foreign body in your system, mistakenly identify your sperm cells as a foreign body or harmful invaders, and thereby destroy it or attack it. So if your body constantly produces sperm, but your immune system is destroying it, it will be difficult for this type of man to impregnate a woman. Number 2, undescended testes. Yes, during fetal development, that is when the baby is still in the womb, the testicles, they are in the abdominal cavity, in the abdomen. But after the baby is born, as it goes with time, the testes, it descends from the abdominal cavity, from the abdomen, into the sac. The sac is the scrotum. When one or both testes fails to descend from the abdominal cavity to the scrotum, there will not be production of sperm. Number 3, cause of low sperm count is infections. Some infections can interfere the sperm production and also the sperm health. Some infections can even cause scarring of the tubes that transport sperm. So now when there is blockage in the sperm, in the tubes that transport sperm due to infections, it might be difficult for that type of man to impregnate a woman. The infections include STI, sexually transmitted infection like HIV, the gonorrhea. Also, infection of the testicles, orchitis, infection of the epididymitis. They can all affect a man's sperm production and sperm health. Number 4 cause of low sperm count I'll be discussing with you today is varicocele. Varicocele is the swelling of the veins around the testicles. When there is swelling of the veins around the testicles, it will increase the temperature in the testicles, and it is one of the common reversible cause of the male infertility. If varicocele is left untreated, it leads to reduced quality of sperm. Number 5, tumors. Tumors in the brain where hormones are produced from, are secreted from, in the pituitary gland or in the hypothalamus, can affect the hormones that produces sperm and thereby lead to low sperm count. Number 7, hormonal imbalance. It is not only women that suffers from hormonal imbalance. Men also does. They also suffers from hormonal imbalance. There is this part of brain, the hypothalamus and the pituitary gland, that constantly secrete hormones responsible for sperm production. Alterations in these hormones can affect sperm production. Also, thyroid problem and adrenal problem can affect a man's sperm production too. Number 8, defects in the tubes that transport sperm. A lot of tubes transport sperm. These tubes that transport sperm can be blocked due to various causes like trauma, surgery, infections too, injury, and abnormal development, such as in case with cystic fibrosis or some other conditions related to this. Number 9, chromosomal defect. Chromosomal defect, it's an inherited disorder in case of Klinefelter syndrome. This is when a male is born with two XX chromosome and one Y chromosome, and a man is supposed to have one X chromosome and one Y chromosomes. But when a man has two X chromosomes and one Y chromosome, there will be problem in the male reproductive organs. Number 10, medications, especially antihypertensive drugs, the beta blockers, those ones like bisoprolol, metoprolol, atenolol, they can all reduce sperm count. Number 11, surgeries. Surgeries like inguinal anal repair, major abdominal surgeries, surgeries in the prostate, testicular surgeries or scrotum surgeries. All these surgeries may prevent you from having sperm in your ejaculate. Now, environmental causes. Environmental causes like too much exposure to X-rays and radiation can lead to low sperm count. Too much exposure to heavy metals, especially lead, can also lead to low sperm count. Also, industrial chemicals like benzenes, painting materials, herbicides, pesticides, they can all lead to low sperm count if you're exposed to these things for a very long period of time. Also, overheating of the testicles. The temperature in the testicles is usually 2 to 4 degrees lesser than the normal body temperature. When there is overheating of the testicles, in case of people who wears tight trousers or jeans, tight boxes, too much exposure to hot tubes, saunas, putting computer on your laps for so long while working can all increase the temperature in your testicles. And when there is increased temperature in the testicles, it reduces the sperm production. It affects sperm production. There are also lifestyle causes like depression, emotional stress, obesity, drug, alcohol, marijuana smoking, tobacco smoking can all lead to low sperm count. Now, how do you prevent low sperm count? Number 1, don't smoke. Number 2, maintain a healthy weight. Number 3, manage stress. Number 4, ask doctors or ask anybody about the medication being given to you. Ask about the side effects of any medications that is being prescribed to you. If one of the side effects it is not low sperm count, ask questions. Number 5, Limit or abstain from alcohol intake. Number 6, if you're suffering from depression, try and get treatment. And number 7, which is the last one on my list, is avoid wearing tight pants, tight boxes, putting computers on your lap, sitting for too long, and so on. Avoid all these things so you don't increase the temperature in your testicles, and this kind of cause lead to low sperm production. Treatment. The treatment is usually depends on the cause of low sperm count. If the cause of low sperm count is infection, you can get it treated with just antibiotics. If the cause of low sperm count is hormonal imbalance, you can be given hormonal replacement therapies, and also there are medications, hormonal medications that can use to treat this in case of high level or low level of hormones, depend on the hormones that is affected. If the cause of the low sperm count is as a result of varicocele or undescended testes, surgery might be your option in this case. But all this can be done, whether medications, injections, surgery, they can all be done after you go see a doctor, undergo physical examination and testing. Go for test, because this is what is going to determine the cause of your low sperm count, and you get treatment for it. Now is home remedies. The first one is have sex frequently. Have sex with your partner, with your woman frequently, because having sex with your woman frequently will increase the chance of you getting her pregnant. Number 2, have sex during a fertile period. During the time a woman is ovulating, try and have sex this time, because a woman is likely to get pregnant during her ovulation. So feel this before her ovulation, and on the day of her ovulation, this is a fertile period. Try and have sex frequently this period. Number 3, avoid lubricant. Lubricants like lotions, saliva, KY jelly, they can all impair the movement of sperm. They can impair the sperm vitality, the motility of sperm. Ask your doctors for sperm safe lubricant. Number 4, eat fruits that are rich in vitamin C, vitamin D, vitamin E, and zinc, because they can increase sperm production. Number 5, exercise regularly. Thank you very much for sticking with me to the end of this video. If you find this very helpful, kindly hit the like button, share, and drop your comment as well. Subscribe to my channel and turn on the post notification. I will see you guys in the next video. Thank you.